All right, so next on the agenda is a panel presentation to explore patient-informed care and PTSD, stories from the front lines. Moderator for this presentation is Devon Dabbs, and she is the Coalition's Vice President of Pediatric Programming and Education. Devon focuses on issues impacting children with serious illness. Previously, Devon was co-founder and executive director of the Children's Hospice and Palliative Care Coalition, which merged with the coalition in the fall of 2015. Devon spearheaded policy initiatives and programs which dramatically improved care for children with life-threatening conditions in California, including the enactment of the Nick Snow Children's Hospice and Palliative Care Act of 2006. So please join me in welcoming Devon.
Hi, how is everybody? So when I say post-traumatic stress disorder, I don't think most people think patients. We think of the men and women on the front line, we think of our veterans, and we definitely don't think pediatric patients. But the reality is that for a lot of our kids, especially those who are now transitioning into adulthood, they've been living on the front lines for most of their life, and in some cases, all of their life. For those of you that were here last year, you may remember we did a panel session with Rachel Goldring and Charlie Blotner, and they were talking about what it was like to transition into adult care as a pediatric patient. They were both living and are living with a pediatric condition, and they talked about some of the challenges of learning to put their trust in a new team, a medical team that often was really learning their condition along with them. And Rachel spoke about some of the trauma related to that, and the challenges in really learning to trust her team and really getting them sometimes to listen to her. And that got us thinking about PTSD. And then we had the privilege of actually having a conversation with Marla Jan Wexler, who's sitting here next to me and who I'm about to introduce. And Marla Jan told us about a study that was done with young adults who had been born with complex congenital heart conditions. And in this particular study, they found that between 11 and 12% of those who participated were suffering from PTSD. So we wanted to start that conversation today because as we do, we talk a lot about transitioning of young pediatric patients as they reach adulthood into adult care, but this is something that we really haven't had a conversation about. And so we asked Marla Jan, who actually participated in the study and was diagnosed with PTSD, if she'd be willing to come and talk with us and share her story. And she graciously agreed to do so. I have to tell you a little bit about Marla Jan. Many of you may actually recognize her. She has been part of our summit for the last 3 years. She is one of our e-patient ambassadors. She has graciously participated in multiple conversations around multiple issues that we talk about in order to really help all of us get better at providing palliative and hospice care to those that we work with and that we care for. And she also is a pediatric cardiac nurse herself. She's taken her own experience and is now working with children and their families who are going through many of the experiences that she went through as a young person. She is undoubtedly one of the bravest people I know. She's also got a wicked sense of humor. And I really can't say enough wonderful things about her, but I would love, and I love that you're going to actually be able to hear her and listen to her, because the reality is we're all out there trying to get better at doing this and learning more. And when it comes to this topic, much of what you might hear today is a little traumatic. That's the term PTSD, right? But while it may sometimes be hard to talk about and sometimes hard to hear, it's really important that if we are going to be part of this solution, the first piece is understanding. And in order to understand, we really have to listen. So with that being said, I am very grateful, appreciative, and honored to introduce Marla Jan Wexler.
All right, guys, I'm really nervous. I've never talked about this before, so. Also, I'm really bad at PowerPoint, so I apologize for how bad it is.
I'm here, I got you back.
You got it, all right.
Well,
I just mean the slides are pretty boring, but all right. So thank you. One morning, I was resting quietly in bed. I didn't feel well. The room to my door flew open, startling me out of sleep. In walked a man I didn't know, heading towards me. He towered over my tiny frame in the small bed, ripped back the covers and exposed my body. As he leaned down silently, I saw he had something sharp and shiny in his hand. I screamed. I thrashed around trying to push his hands away, but he overpowered me. I watched in horror as the scissors came closer. I begged him not to hurt me, screamed for my mom, but he continued towards my chest with the scissors. He hurt me. The pain was sharp and it was piercing. There was pushing, pulling, and tugging, and what came next just took my breath away. I stopped thrashing and submitted to the pain, knowing that if I kept fighting him, he would just continue to hurt me more. And just as quickly as he had entered the room, he left without a word. He didn't even pull the covers back up over me, leaving me cold, scared, crying, and frightened. Sorry, guys. All right, we'll just skip that. So that was in 1987, while lying in a hospital bed about a week after my 4th heart surgery. The man was a surgical resident who came in without warning, without saying a word to me, without giving me pain medications or waiting for someone to hold my hand. He found the rare 5 minutes my mom left the bedside for a cup of coffee. He cut and removed staples and sutures from my chest and then pulled out 2 chest tubes. He was so hell-bent on completing the task he was surely given by his attending physician. There we go. He was so hell-bent on completing the task surely given by the attending physician that he didn't realize a human being, let alone a small child who didn't understand, was the one in the bed enduring the pain he inflicted. By the time my mom came back, I was carrying on so much that my oxygen levels were dropping, and the nurse said she was my mother in an attempt to calm me down. I was 6. I was not an idiot. "You're not my mommy," I screamed as my mom came into the room, ran to the side, and told me she was here. But by that point, I had completely disassociated myself from the situation. "You're not my mommy." Sorry. I screamed over and over, panicking. She said that she was my mommy. She showed me her slippers that I called her ducky slippers, walked around the room so the fabric of them rubbed together, making the familiar sound that I loved. And she told me that I was okay. Just drink. Sorry, guys. I didn't think this was going to be this hard. She told me that I was okay, but I don't remember ever being so not okay. There we go. I could tell dozens of similar stories that I experienced growing up with tetralogy of Fallot with pulmonary atresia, a complex congenital heart defect. At 36, I am part of the first generation to not only survive, but thrive into adulthood. Thank you. Yet only recently have healthcare professionals studied the physical and psychological repercussions this group of patients have encountered from the trauma we endured since birth. By the end of 1987, I had 4 heart surgeries, 1 Blalock-Taussig shunt and 3 open heart, cardiac catheterizations, and so many chest accessories that I should be glowing. I've gone into cardiac arrest, been intubated without sedation, and on ECMO. I endured all of this before patient family-centered care, before child life specialists, before treatment rooms, and most impressively, without narcotic pain medication. This was all before the development of Dilaudid and fentanyl, a time before pain was subjective and continuously managed, especially in children. My cardiothoracic surgeon who performed all 3 heart surgeries was Dr. William Norwood, inventor of the Norwood procedure, which today is still the gold standard in the first of 3 surgeries for the treatment of hypoplastic left heart syndrome. At a time when CT surgeons were not willing to be aggressive in the advancement of surgical therapies for babies born with CHD, Norwood was willing to think outside of the box. He fixed our broken hearts, hearts the size of shrunken plums and veins slimmer than angel hair pasta. In my years as a pediatric cardiac ICU nurse at the Children's Hospital of Philadelphia, the same hospital I had my surgeries, I worked with nurses who were there in what we called the Norwood era. I've been told repeatedly Dr. Norwood was barbaric. He didn't allow his patients to be administered pain medications, that the nurses would sneak Tylenol to us to take the edge off our suffering. This is the man who my parents and many alike claimed had the hands of God. He wouldn't know me if I walked past him on the street, but his hands have been inside my open chest 3 times. He's rewired and patched up my heart so that I could live. He developed a surgery to buy time for patients who were otherwise all going to die. It's where ethical equations get sticky. How much of a learning curve should a doctor or parents tolerate, considering the potential payoffs down the road? And at what cost? When it comes to my generation of patients born with CHD, we are just now learning. The 2 people who were supposed to protect me, my parents, stood back as perfect strangers poked, prodded, and hurt me. How could I comprehend that my parents let these things happen in the hopes of keeping me alive? They allowed men and women I never met wheel me down a long hallway while I looked back at them as they cried and held each other. I remember entering the cold, sterile room filled with frightening machines and surgical instruments. I was lifted, naked, onto an operating room table and strapped down. I had taken the giggle juice, but it did nothing. I was hyper aware of everything going on around me. The anesthesiologist asked one of the scrub nurses to take off my nail polish. I was the picture of bravery until that poor nurse went to take off my nail polish that my mom painted on the night before my surgery. Poor nurse. She's probably more traumatized than I am. Priorities, people, though. I screamed, I yelled, I tried to jump off the table, but I was held down by the straps. No one takes off my nail polish. To settle me down, the anesthesiologist promised he would buy me a bottle of pink nail polish. I stopped carrying on, and I vividly recall the mask coming down on my face and the smell of the cherry sleeping gas. I hate cherry. A single-center study conducted at the Children's Hospital of Philadelphia found that as many as 1 in 5 adult patients had PST symptoms, with about 1 in 10 patients having symptoms directly related to their heart condition. This is the first study to examine the prevalence and correlates of PTSD in the ACHD population. As Devon said, I am one of the participants in this study. More than 85% of children born with congenital heart defects now survive into adulthood. Really, I'm crying at this. Although life expectancy of patients with moderate or severe congenital heart disease has improved, their care is complex, often requiring multiple surgeries and interventional procedures. Currently, there are more adults with congenital heart disease than the annual number of babies born with congenital heart disease in the US, despite CHD being the most common birth defect. The study reveals there is a growing population with important unmet needs due to the chronic, lasting effects of the traumatic stress the CHD patients experienced. A total of 222 patients were invited to participate in the study, of whom 138 consented and were enrolled. 4 patients were excluded from the final analysis, generating a final sample size of 134. Findings were twofold. First, based on self-report measures, 2 in 10 patients with ACHD met criteria suggestive of PTSD, and 1 in 10 met criteria indicative of PTSD that was specifically related to their underlying CHD. Second, elevated depressive symptoms and earlier year of most recent cardiac surgery emerged as 2 factors most strongly associated with PTSD. The prevalence of likely PTSD detected in the cohort of 11% to 21% was found to be several times higher than the 3.5 observed in the general population. Again, 1987. It was not my best year. Undergoing cardiac catheterization, I felt like I was being stabbed with something in my right leg. I screamed, I tried to get up off the table, but someone shoved me down. I tried at least 5 more times to get up, but my attempts were feeble. By the time I was in the PACU, my forehead was swollen and bruised, dried blood on my face, and I had 2 black eyes. My mom said that had it not been for the white blonde hair sticking up, she wouldn't have known it was me. I was unrecognizable. I had woken up mid-procedure, feeling the catheter advancing through my femoral artery. Each time I sat up, my head met the overhead surgical light, and the force knocked me back down. I was 6 years old and at most 40 pounds. Fear certainly gives you superhuman strength. 30 years have passed since 1987. Crazy. The memories are no less intense than when I was actually experiencing it firsthand, and the fear still lingers. I continue to get that fight or flight response. I'm having it right now. I'm suspicious of everyone, thinking at any given moment they could hurt me in some way. Some may call it highly aware of my surroundings, but I know it is far surpassed that. I get anxious, I get panicked, my respiratory rate goes up, my pupils dilate, taking everything in. My heart starts pounding. I start shaking, palms sweaty. And yet, instead of taking myself out of the situation, I can't move. Like all I know is how to wait for the pain and hurt. Throughout childhood and adolescence, not one person, doctor, nurse, social worker, ever sat and asked me how I felt. Sure, from a cardiac standpoint, I looked great. I had pink lips and fingers, I didn't have clubbing, there was no TET spells causing me to drop to a squatting position at any given moment. I was a success. Until the age of 17, I slept with a nightlight. I was terrified of the dark. Dark meant death. I can recall having insomnia as early as kindergarten. Frightened to go to sleep for fear I would not wake up. I had this game I would play in my head. If I faced the nightlight, then Dr. Norwood could see what he was doing and fix my heart. If I faced away from the light, I would die. The nights I woke up at 3 a.m., back facing the nightlight, left me broken. Going off to college and sharing a dorm room brought on a new level of anxiety. I'm never going to fit in. I'm covered in scars. How would I ever sleep with my nightlight? How could I make a nightlight cool? You can't. I have a remarkable ability to delete all better judgment from my brain when I get my head set on something. Everything is done at all costs. I have no sense of moderation, no sense of caution. I have no sense, pretty much. I dove heavily into drugs and drinking. It's typical for college freshmen to go a bit overboard with his or her newfound freedom. But for me, it was about freedom from the pain. I didn't care about the detrimental effects drugs and drinking could have in my heart. All I cared about was not feeling anything. I wanted to be numb. I didn't care. Eventually, it wasn't enough. Slowly but surely, my demons came back with a vengeance. I felt too much, too aware, filled with anger and rage, suspicious that everyone was out to get me. Imagine feeling like you don't have control of your own body, that it's yours, attached to your head, but it doesn't belong to you, that its sole purpose was for someone else to touch, to see, to draw blood from, to listen to cut, to put needles and tubes in, and to hurt. Men are embarrassingly easy to seduce, and it felt like a game. Find a cute guy at a party, dance with him and share a few laughs, then go back to his room and sleep with him. I had power, control of my body. I called the shots. I was careless, I was numb, and I felt nothing, and it meant nothing. Make them fall in love with me, and once I knew I could have them, move on. Be in control. Hurt them before they ever had a chance to hurt me. I don't know how to have a healthy relationship, intimate or platonic. That's a great dating ad right there. When you think the entire world is out to get you, it's incredibly difficult to let someone in. I've lived my entire life in a constant state of DEFCON 5. Calm and happy is not something I do well. I yearn for calm and happy, and the moment I find it, the switch flips and I jeopardize it, like I can't allow it in my life. I self-destruct and sabotage good relationships because I don't feel like I'm worthy of happy and calm. I'm angry all the time. Angry that none of the people who inflicted all this pain on me never thought to ask me how I felt about it. I've been brave for 36 years. It's my claim to fame. Oh, Marla, how brave you were when that stranger ripped tubes out of your chest and traumatized you for life. No one has ever said to me that it's okay to be angry. This was not easy to write. It was not therapeutic in the least. It was really wrenching to go back and hold up a mirror to see how I live and what I believe. This has been deeply painful for me, but I'm sharing it because I want people to know what it really looks like, that it's not always about being brave and wearing your cape, and that's okay. I'm sure you all can only help but wonder why I agreed to get up here and share things about my life that until now I've kept secret from everyone. I know these things were challenging to hear and may take you some time to process. Hell, I've been processing over all of this for over 36 years. It won't benefit me today, and I'm quite certain I'll have to give my therapist a sizable bottle of Irish whiskey Friday morning when I see her. But you can benefit from my story. These conversations are intense and painful. Nothing about this is easy for a patient or a provider. My hope is that patients like me don't have to live a life of fear. No two people experience things the same, but trauma is trauma. Hard is hard. Support us. Let us know you are on our side. Pull the pin and throw the grenade and have the hard conversation. Thank you. that bottle in my hand, the anesthesiologist bought me pink nail polish. He kept his promise. Forgot about that. Okay, breathe.
I just have one request, if you guys don't mind. Could we all in unison say to Marla Jan, it's okay to be angry? Thank you. So I'm looking to the back. I'm not sure where we stand on time. Do we have... We're out of time, okay. So I do want to invite you, though. We're actually going to be staying here in this room, I believe. I'm looking at Keita, is that right? For those of you, as part of our interactive session, if you'd like to continue this conversation, Marla Jan has graciously agreed to sit and talk with you and answer some questions. So if you'd like to be part of that dialogue, please stay and join us. Thank you.